Hola everyone, welcome to Flexibility Script. Today's video is going to be going over some releases that can be done to help any tension that you may be carrying along your face and neck that sometimes contributes to things like headaches or jaw pain or just the neck pain from like a forward head type of position. So the releases I'm going to be doing will be using this pinky ball. It's just a soft bouncy ball. It has some give to it, the give makes it nice because we don't have a lot of I would say a lot of density to these tissues along this area, so the softer balls tend to work really great. I'm going to be doing a release for this area here around sternocleidomastoid, and then right along the masseter here, and then also right along the outside temporal muscles here. So I will say I will look really funny when doing these releases because my facial expressions for some of them, specifically the jaw, and when I come right up here will look a little odd. But this very first one, so I'm going into this, I'm going to be trying to tack this tissue down and tacking it, twisting it, and then letting myself go into this back range of motion to open up the musculature along here while I'm having an effect on the fascia in this area here. So to do this, I kind of come into the neck here, and what I usually do is I soften that tissue by just doing a little bit of a side bend here, and I'm gonna bring my head almost like ear instead of directly to the shoulder, kind of at an angle towards the opposite chest. That ball's gonna tack down. From there, it's twisting, very small twist, and then I'm gonna lean back, and then I let it go. Then again, I'm gonna bend, tack, twist, open up, and back, tack, twist, open up. And I usually do anywhere from 10 to 15 reps. Again, when I tack the ball down, you notice that I'm not actually rotating it. If you just see my forearm, I'm tack, then twist, and then let it go. Tack, twist that tissue underneath it very lightly and let it go. And then before I let it go, I add a range of motion. So again, get that tissue nice and supple. I'll bring that ball in, tack, twist, come back. So tack, twist, come back. So I'm there, and as I keep going, I can kind of freestyle a little bit, and I can come up maybe just a little bit higher, gently pressing down, twisting, coming back. But I usually find like that middle part is usually the area that's carrying that bit more of a restriction in the tissue. So anywhere along here, again, you'll usually find right in there. So if I'm looking at you straight on, I'm coming not here, but coming right along this area here, this musculature here. Again, tack, twist, and stretch. So this next one is gonna look funny. I'm gonna be coming into this area here along my jaw here. Sometimes people dealing with TMJ can have some sensitivity in this area, or if when you sleep at night and you clench your teeth when you're sleeping, or grind your teeth, I think is the word I was wanting to use, that you can end up carrying some tension, and it could end up causing some headaches, some neck pain, and it's really simple to kind of go into this area and be able to do it. Sometimes if I don't have a ball, I use my fingers, and thinking that same technique of tack, twist, and then to create that stretch, we're gonna be opening our mouth up. Or I'm going to be opening my mouth up and you'll see my mouth. So I'm going to be right in here. I'm going to tack, twist, and then let it go. Again, tack, twist, let it go. So every time I tack the ball down, I'm always being really light. And then I'm just spinning that ball to tack the tissue, twist that tissue underneath it. And then from there, and I just keep going. Tack, twist. I'm just going to be focusing in on this side of my face, so you can end up seeing the difference by the end. Again, tack, twist. And same thing, I keep it kind of light in the 10 to 15 range, but sometimes you end up seeing this difference in the way this whole, it can start coming from the eye, how it all starts looking a bit more relaxed as I keep letting go of tension along the whole area. Again, so review, tack, twist, Okay, so that's part 2. Part 3, I'm going to be coming right along this area here. Now this you can freestyle and do whatever you like with your jaw. If you wanted to freestyle when we did this area and do one of those, you're welcome to. So it would be, and kind of wiggle it around, tack. It looks funny, but effective. Same thing. So when it comes to this area, I can freestyle with some of what I do with the musculature around my forehead. So I'm going to be taking the ball and I'm placing it right along the outside here. Usually sometimes where you're carrying some tension, maybe some sinus tension. Again, tack, same thing, tack, twist, and let it go. So I usually work on looking left, right, squinting, and letting go. So again, I can tack, twist, left, right, up, squint, again, tack. And I could just pick one motion. Or do all. And what you'll notice is as I've kept going, I'll scoot this in just a little closer. It almost starts looking like I've depressed one side of my face, and this whole side is much more visually much more relaxed in comparison to what's happening over here along the outside. I'm gonna go ahead and I'll turn the video off and address the other side so I don't look so discombobulated. But again, head right at the jaw, right next to the eye, right around the jaw area, and right along the tissue along the neck here, along sternocleidomastoid. And the technique, tack, twist, and then add a little bit of a stretch to it as you're going through it by leaning back, by opening the jaw, or creating this contraction here and opening up, or looking left to right. All will work. Give it a shot, especially if dealing with any head, neck pain really is when I usually use this. With jaw pain, if you clench your teeth and you're carrying some tension that you're feeling along the side of the neck that for some reason you're trying to figure out how to stretch or do, just know that you can just gently mobilize with a little soft ball and be able to create a bit of relief to any pain and discomfort that you may be dealing with that area. So give it a shot. Bye.